So welcome everyone to the latest installment of CADCA's Research in Action webinar series. I'm Carolina Duth and I'm a member of CADCA's Evaluation and Research team. If you haven't previously participated in one of our webinars, the purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. I'm joined for this installment by Leonardo Kattari. He will present on his and his colleagues' article, Community-Driven Approach for Youth Health Survey Administration and Data Utilization, which was published in Health Promotion Practice in 2021, and will discuss strategies for successful community engagement in the administration of youth public health surveys. Next slide, please. And now I'd like to introduce our presenter, Leonardo Kattari. But before I do that, I'm going to launch a quick poll. It's just about getting to know the audience. So if you can just fill this out while I'm reading the bio about the presenter, that would be great. So Leo Kattari is a doctoral student at the School of Social Work at Michigan State University. He is a passionate advocate for health equity and social justice with over a decade of experience in the areas of health education, organizational development, community mobilization and organizing, policy, public health data, and evaluation. Leo's research focus is on health equity and policy across the lifespan, specifically focusing on health access and outcomes among transgender and gender diverse individuals and communities. Okay, is everyone finished with the poll? It looks like 75% have voted. So if you're still working on it, you have like 5 seconds, and then I'm going to share the results. Okay. So here's the results of the poll. It looks like we've got almost half of the attendees are in coalitions in working in rural areas, so that's good. And then it seems like over half have also had your school district participating in a statewide youth public health survey, such as YRBSS. All right, so thanks for filling out the poll, and I'm going to turn it over to Mr. Kattari now to discuss his work.
Thank you so much, Carolina. Thank you for having me, and thanks everyone for being here. I'm excited to talk about community engagement today with everyone and work through these awkward slides in Zoom. I don't know about you, but I'm kind of sick of Zoom slides and presentation. But I wanted to elaborate a little bit more about me and show a beautiful picture of my pandemic pup who's 4 years old. Her name is Marla Pooch. So if anyone knows A League of Their Own, she's named after Marla Pooch. But I'm currently a PhD student at Michigan State University in social work. And as Carolina said, my research area primarily focuses on community change and health outcomes for transgender and gender diverse communities. So I'm a social worker by training. I have my MSW from the University of Denver. And a lot of my work has focused on community engagement and community change, all the way from training folks around evidence-based health education programs to supporting folks providing testimony for legislation and policy change. And then I ran the Healthy Kids Colorado survey that we'll be talking about today for a little bit. I also teach graduate level community change courses at the University of Michigan. So the teacher in me is likely going to come out during this presentation. So I appreciate you humoring me through that process. And then I do just want to make a quick disclaimer that I no longer am affiliated with the Healthy Kids Colorado survey, nor any of the organizations that sponsor it, like the Colorado Department of Public Health and Environment. So I just want to throw that out there that this is just me, my thoughts, based on my experience working on the Healthy Kids Colorado survey. And so what is the Healthy Kids Colorado survey? Giving some foundational information. It is a comprehensive survey on middle and high school students' health and well-being. And we ask questions ranging from general health outcomes to substance use, to sexual health, to nutrition, to protective factors and trusted adults. So when I say comprehensive, it is comprehensive. And it originally started as Colorado's version of the CDC's YRBS. And so many of you, about half of you said, your school district does some kind of youth health survey. It's probably YRBS, might not be. And the YRBS has been around since the 1990s. Now, what makes the Healthy Kids Colorado survey different than just your standard YRBS is, number one, the sample size. So for most states, dependent on samples of the population size of the state, the sample can range from anywhere from 1,000 to 2,000, maybe 3,000 students. Larger states, maybe 5,000. But they're fairly small sample size. So it's hard to deaggregate the data and look at different outcomes of young people based on subgroups and populations. And so the example we'll be using here is rural communities. So the feedback we kept getting with the Healthy Kids Colorado survey is that our sample, while it was supposed to be representative of the state as a whole, when you're sampling and you're sampling based on the population, well, the population is really concentrated within urban areas. So our rural partners kept saying, we're not represented in this data. This is not accurate of us and who we are. And so we really wanted to take a step back and be like, how do we change that process? And a piece of that was reducing the burden on schools around the lots of different types of health surveys that were being administered in schools and we're asking young people to participate in. So we created an advisory committee and reached out to all the different partners across the state who were conducting school-based health surveys to streamline those efforts. And then we created regions across the state so that the data could be based on a region and more representative of what that region looks like based on those demographics, the geographic aspects of it, et cetera. And so this gave us, this empowered communities to feel more invested in the survey and also feel that the results will better represent who they are. So that's kind of the foundation of Healthy Kids Colorado survey. So we went from sampling about 2,000 students typically to now, I think the 2019 administration of it had almost 60,000 students. So you can, just by that alone, 60,000 students, what a robust, beautiful sample size that is to really get down to the details of what young people are experiencing. So we're able to look based on geographic regions, but also based on race, age, ethnicity, sexual orientation, gender identity. And we can really look at different subgroups of young people to know exactly what's going on in our communities of young people across the state. Like pretty much every health survey out there, especially those being conducted in schools, Healthy Kids Colorado is 100% voluntary, confidential, and anonymous. And so, for example, school level data is only shared with the kind of administration of the school. And we typically, any responses for questions that had less than 30 responses were not shared, and there would just be a dash there. So it's protecting young people and their confidentiality is super important to this process. And another piece of this is that multiple levels of consent are required before a survey ever gets in front of a young person. And so talking through a little bit about what that looks like is, number one, we had to get school district buy-in. So we need a superintendent to say, yes, you can survey our young people, right? And that was one kind of stakeholder, the ultimate decision maker. Then we had to get principal buy-in for building access. Then teachers play an important role, but they don't have decision-making power, but teachers are super important to this engagement. Parents can opt in or opt out their child, and the districts have their own policies around whether it's an opt-in policy or an opt-out policy. And then of course, a young person can decide for themselves whether or not they want to take the survey. And so when we were thinking about community engagement, we had to consider all these different stakeholders, all these different levels of decision-making and power, and how can we best engage people at these various places in which they exist. And this also includes community leaders outside of the school system itself, right? Those community partners are so important. So stakeholder engagement, community engagement is key to any kind of recruitment and research engagement. we're going to talk a lot about kind of what that process can look like. Another aspect to think about is that not all stakeholders are going to be in agreement, right? And that's going to be your role to facilitate and navigate what that looks like, figure out what compromise looks like for your community, and how do we make this localized and beneficial for everyone, which are sometimes hard conversations to have, depending on history, context, and where people are coming from in their experiences. So before I kind of go through some of the barriers listed on here, there's another poll we have. So Caroline, if you can launch that poll, I want to get a sense to what you feel like is your primary barrier for stakeholder or community engagement. Is it something around access and accessing communities and individuals and students? Is it trust and being trusted by your community partners or not being trusted by them? Is it funding? Is it time? And then if it's none of the above, you can please add more in the chat box. So we'll give you a few seconds to fill out that poll. Some other types of barriers that are in the chat: commitment, all of the above. I knew that would be one. All of it. And then communication engagement. The community does not always see the benefit. And then looks like majority in the poll say time, but access is a close second. So yeah. So community engagement is very time intensive, especially when we're doing it well, especially when we want to build trust in relationships. Because the last thing we ever want to do is just enter a community, get what we want from them, and then leave them hanging forever after that, right? And so there's a lot of intentionality and thoughtfulness that has to go into community engagement. And that includes engaging people based on who they are, right? The way you're going to engage maybe a policymaker is going to look a lot different than you engage a young person or a student, right? And so having to adapt and transform that not only is time intensive, but sometimes you need different types of resources and access and trust. And there's a lot of conversations and discussion that needs to happen around, what is the benefit? How it's not just benefiting you and your organization, your coalition. How does it benefit the individual you're talking to or the local community itself? These are all super important, and these are all real barriers. And while we're going to talk through some strategies for navigating these barriers, they're not going to solve everything overnight, right? And so that's where this time comes back in, and that these are long-term strategies. They're not just going to change everything and make everything better all at once. So I do acknowledge that as a limitation. So the strategies we're going to talk about, they are, and I wanted to put a Venn diagram on them because we're going to talk about them separately, but they definitely interconnect and they build upon each other, and you need all of them to make a good community engagement strategy altogether. And so we're going to talk about building trust. We're going to talk about relying on local expertise, and then we're going to talk about showing up and what that can look like in different ways. So the first strategy is building trust. And I use the term building trust rather than just relying on building relationships, because you need both relationships and trust, but the trust is at the core of what you're trying to do, right? And I keep talking about intentional and strategic relationship building. And this is true. We need to identify who our partners are. And I like to use this concept of the spectrum of allyship. And allyship might be the wrong word for what you're trying to do. And maybe it's more like spectrum of engagement, spectrum of support, spectrum of interest, right? And you can change and adapt that to fit however you're practicing community engagement. But thinking about this spectrum, or this like half wheel, identifying who your partners are and where they fall in it will help you be more intentional about where you want to put your energy and effort, and your very limited time and resources, right? Many of us have our active allies. It's probably the folks who are part of our coalitions already, right? And so really what we're doing with them is we're maintaining momentum. But what we want to do is look at our passive allies and our neutral folks, and how do we make them more active allies? How do we bring them to the next step in that, right? And maybe folks who have passive opposition, we also want to work with, and folks who are actively not in support or don't have time or capacity to work with, it's our choice to say, you know what, we're going to follow. We'll return back to you at another moment. But right now, for what we're needing to do, it's not necessarily the best use of our time and resources to engage in you right now. But we will continue to work on that, but we'll kind of put a little pin in that for later. Another piece about building trust is acknowledging your outsider status, right? If you're going into a community or an organization that you typically aren't working with and you're establishing a new relationship with, acknowledge that, name that, right? So, and one of the things that often would come up for me was, as someone who was working for the Colorado Department of Public Health and Environment, so governmental agency, I had to say, yes, that I am an outsider and I'm representing the government and I have the broad statewide lens, but I am interested in learning about your local lens as well, right? And saying, while I don't live here and this is not my experience, your experience is important, and I acknowledge my limitations around that. And when we're building trust, we want to make sure that we're building up and investing in those local champions, right? And that their voices matter, and we're not just relying on the folks who are always at the table, but we're engaging folks to the best of their capacities and energy levels across the board, and really trying to invest in building that local capacity for engagement and change in whatever activities we're trying to do. The second strategy is, again, this local expertise, and really it's so important. And acknowledging that I myself do not have all the solutions and that the community does, right? And so with the Healthy Kids Colorado survey, maybe I would assume that getting a superintendent buy-ins was the issue, right? But once I sat down with the community and learned from the folks who actually live in the community and work in the community and have partnerships with the schools, they could sit down and say, actually, it's not the superintendent, it's this, or here's the concerns, or here's this just misinformation about what the survey is that's going on and needs to be addressed, right? So I might have some kind of knowledge about what's going on and some of the issues or problems or concerns, but I don't actually know for sure. Folks who live in the community do. We need to rely on that. And oftentimes that means that we need to step back a little bit and take on the supporting role of those local experts or local community leaders. And that we don't always have to be in the lead or in the spotlight of this. And that community engagement, a lot of the work that happens actually happens in the background. And that community buy-in and community trust is usually built from the bottom up rather than the top down. So again, me acknowledging myself as a governmental employee was really important to say, I'm not here to tell you what to do and make decisions for you, but I'm here to support you in being successful. And I want to provide resources where I can and guidance where I can. Not that I have all the answers or solutions, but I do have some more resources that maybe small organizations don't or community coalitions don't, right? And trying to connect those dots for folks, right? And being a support rather than necessarily being the lead. And then also trying to avoid having all the answers and making all the decisions, which is hard, because usually the pushback I get to this is that, well, decisions need to get made. And yes, they do. But when we have those relationships and we have that trust, we can make the most informed decisions for moving forward, knowing that our decision is representative and informed by what's going on at that local level. And going back to that thought around time and how much time community engagement and stakeholder engagement takes, is trusting the process and giving it the time it needs to be established. And while we often have this sense of urgency, we're working on grants that are time limited, we have funds that might be time limited. we do need to push back on our funders and say we need to take time and we need to trust the process. This is going to go well, and relationships don't just occur overnight. Leadership doesn't just develop overnight. We need to invest in this, and part of that investment is that time and trusting that long-term process. The third strategy is this concept of showing up. And for those of you who maybe have a background in social work or community change work, you've probably heard the phrase before of meeting people where they are. And when I say this, I mean this figuratively and literally. Figuratively, we are meeting people where they are. You know, we don't want to push them beyond what they can do. We don't want to assume they have resources they don't or time that they don't. And then literally, it's on us to show up and be there physically for people. COVID makes this a little more challenging, where we're not there maybe in person, but we're there via Zoom. And this goes into prioritizing those one-on-one meetings. I used to say face-to-face is the only way to go. But again, I think where we are right now with the pandemic, that we can make things work with video chats. But I think the importance is really with that being able to see someone face-to-face and have discussions with them. And an example of this I had with the Healthy Kids Colorado survey is when I first took on the role, we had an advisory board with folks from across the state that was kind of guiding and advising my role, and then the other governmental agencies on like how should we approach this and make this the most community engaged and most relevant across the state. And one of the first things I did was set up meetings with each advisory board member, and I drove across the whole state of Colorado one summer to meet with each person individually to get to know them, ask them about, hey, what's going well, what's not good, how can we improve, what are some of your concerns, what do you need from us? And you know, I'd take them to a local coffee shop, we'd buy them a cup of coffee, and one point I was in a small mountain town, about 2.5 hours outside of Denver, and I was located in Denver. And this advisory board member said to me, I've been on this board for 10 years, and you are the first person in your position I've met in person. And I was a little flabbergasted by that. I understand traveling is hard. You know, I had to rent a car. I had to pay for gas mileage, right, that my agency paid for, and it's challenging. But that one-on-one connection is so important to community engagement. And I was a little shocked that we're asking our advisory board members to keep working for us, and we're not investing back into them. And so those one-to-one meetings, whether they are in person or via Zoom, are important. And one thing I did notice, and I'm going to keep talking about this one-on-one because it's important, with Zoom, while it's not ideal to sit on video chats all day with people, and it's super draining in lots of ways and fatiguing, we are meeting people in their homes. And so some of the meetings I've been doing this past year plus, you know, I've got to meet people's pets, and I've got to meet people's kids, sometimes even their partners when they would accidentally cross the screen, right? And so there's this humanization that happens even during Zoom that I think represents what I'm trying to get at when I'm saying these one-on-one meetings are so important, right? Because it helps you find out more information about their organization. You know, I got to take lots of tours of buildings and meet other staff members, learn more in depth about the work that these organizations are doing, and make the connections between the Healthy Kids Colorado survey and the work they're doing beyond just saying, we need your help to recruit people. And I also got to learn personal facts about folks, you know, who their pets are, that they love dogs and go on hikes every weekend, or they were going on a vacation, right? And then it humanizes and builds that kind of, breaks down that boundary that we often hold between the personal and professional. Because I do want to acknowledge that most of us are not doing this really important work for the paycheck. Yes, we do get paid for our work, or hopefully we get paid for our work. But a lot of us are doing this because we care deeply about the issues and we're passionate about it, right? And so many times the personal is professional and vice versa, right? And so, you know, navigating that barrier or navigating that concept can be challenging, but it's also important. And to remember that we're all human beings trying our best, and we're all showing up because we care. So even if we might disagree on our approaches and our methods, I think we all can agree on some of the common goals, right? And so thinking about the Healthy Kids Colorado, some of the common goals that we would think about was, what does the data provide in terms of applying for grants? How can we help local communities that are under-resourced and underfunded apply for grants using this data because they don't have other data to rely on? How do we show that, youth health, your local community is having this issue around youth health? And maybe we need to focus on mental health. That's what's happening in your community. Yet the community down the road, they're focusing on substance use, but your community needs mental health, right? And that's why it's important to participate in this survey. Or other things we would do is, how do you understand data and research, right? Most of us maybe know a little bit about research and what statistics are, and when I say statistically significant, what that actually means, but most folks don't, right? We don't live in the ivory towers in that way, right? And so how do we translate data into action, just like this webinar series, right? And it gives us that opportunity to really say, this is what's happening in your community, and what is your community's solutions to that, and working together to do that. Also, when we're showing up, it gives us the opportunity to just sit and listen rather than keep talking, because you already know what you have to say, but really sitting down and listening and hearing what's going on for an organization or an agency or a coalition or a school or community group, it really helps illuminate what's going on there for you, so you can kind of drop your assumptions and really just hear what's going on. And then another piece of showing up is I like to divide it into, you could passively or actively show up. In some ways we can passively show up, or things like donations, maybe shooting a email every few months, checking in, how are things going? And then there's more active ways that we can support and show up, right? And build that trust and elevate that local expertise, right? We can volunteer for them. Maybe we volunteer for their board of directors. Maybe we volunteer for an event they're hosting. Maybe they're doing a 5K, and we volunteer to sign up registrants, right? Or we attend the 5K itself, but we're visible in the community, and we're showing them that this is a mutually beneficial relationship, and that they have buy-in in you and you have buy-in for them, right? And we can also offer in-kind support. And so one of the things I would do for some of the organizations in more rural areas that didn't have an MSW on staff but wanted to have an MSW intern was that I would offer free of charge supervision services for that MSW intern. And so I wasn't supervising their direct day-to-day activities or operations, but I was meeting with them once or twice a month, talking about how what they're doing at their internship connects with what they're learning in their social work courses, and taking that on, rather than that organization having to pay for another kind of MSW supervisor or not having an intern at all. And while interns are a lot of work and time and dedication, they often are also really beneficial and helpful for staffing for many organizations. So that's an example of the kind of in-kind support that we can be doing for the organizations, coalitions, and communities we're working with. And I also want to acknowledge that this comes with lots of limitations. And number one, we've been talking about this is time consuming, right? And we need to push back on this sense of urgency we have all the time that makes us not really give the dedication and time authentic and intentional community engagement needs, right? And we need just to say, this is not going to just happen and form in 3 months or a year. Sometimes this takes many, many years. And I think another kind of challenge that comes up when we're thinking about time is that a lot of our organizations and coalitions have a lot of people transition, right? And so how are we documenting the historical knowledge and historical activities and participation that we've seen so that we're not losing that previous time and we still have that as part of our approach and understanding of moving forward? Another limitation is that community engagement is resource intensive. And we should be pushing back on our funders to understand this, and that sometimes we're not just funding our own operations and programs, but we want to fund our partners and coalition members as well, and how important that is. And then planning, evaluation, and prioritization is needed. So we need to prioritize the work we're doing, because we're not going to engage beautifully with everyone all the time, right? So we need to make sure that we're thinking thoughtfully about who and where our energy is going. We want to evaluate the process. And when I say evaluation, you can do formal evaluations and have surveys and analyze the data, but you can also do super informal evaluation, right? Sending maybe 2 or 3 questions that's about what's going well, where can we improve, what can we do better, and what other thoughts do you have for us? Just so you're getting some kind of feedback, so that we all can learn and grow and develop, and get that feedback directly from the folks who are most impacted. And then it takes a lot of planning, and I'll talk a little bit about planning and how hard that can be in our next slide. I'll get to it. So minimizing disengagement, right? I think a lot of us have experienced that at the very beginning or initial stages or around a specific goal. Sometimes there's great momentum, right? But then once we're going on for a little bit, we're past that one milestone, we've done that one event, we start getting disengagement and kind of things fizzle out a little bit. So ways that we can minimize disengagement is, number one, having a clear purpose or ask. I am asking you to do X, and letting them be able to, and very clearly asking what is X, right? And not being, and avoiding that gray area of what X means. And so a piece of that is clarifying roles. I'm the facilitator and you just need to get people to show up, right? Or vice versa. You're the facilitator, I'm going to get people to show up, right? What are the roles and expectations? And then asking upfront about their level of capacity for engagement. One of the things that would come up, especially when working with rural communities, is that the executive director of an organization was also the wellness coordinator for the school district, and was, also parenting and volunteering for the PTA on the weekends, right? And so time just wasn't there. Energy just isn't always there, right? And so even though people are passionate and want to engage, sometimes they just don't have the time and capacity to do it. And we need to be honest and transparent about what that looks like from us, for the asks that we want people to show up for, and to ask them seriously, like, is a monthly meeting too much for you? Or a monthly meeting and 7 subcommittee meetings throughout the month, is that too much, right? And so having a clear purpose and clarifying what those roles look like, and being transparent on both sides around what our capacity is super important. And another piece of that is developing some kind of feedback loop. Right? We want to ask for feedback, right? Evaluation is really important, and we want feedback. We want to hear what's going on, what we're doing well, what our limitations are. And when we're given feedback and we receive feedback, we want to be accountable to it. So we want to act on it and change it and do better. And then we want to follow up and say, here's what we've done based on your feedback, so that we can continue that process ongoingly and have consistent feedback that's being addressed as we're moving along, and going through the process, and not just waiting for things to fizzle out and then being like, oh, we need to revisit that. So by keeping that feedback loop going, we can kind of keep momentum going as well. And then this thought of planning. What I like to say is have a plan A and then have a plan A, B, C, D, E, F, G, all the way down the alphabet, because you should always plan for things not to go according to plan. I think we've all seen that in the past year with the pandemic, and we've all had to adapt and change real quickly to lots of different changing environments. So sometimes that happens on large scales like that, and sometimes things change and need to be adapted, and you need to be flexible at a smaller scale. And so planning for things not to go how you thought they would is always just a good kind of way to approach community engagement, and try to maintain momentum. And this is a good place where you can get feedback. It's like, what's going to keep you interested? Maybe it's a newsletter. Maybe it's not. Maybe it's Instagram posts. Maybe it's TikToks and videos that get sent out. But how do you maintain momentum and have maybe little milestones between those larger goals and activities that keep people engaged, and feel that they're getting something out of being part of your coalition, or see that they're having an impact somehow, because ultimately that's what we all want to do, is we want to know we're having a positive impact on our community and making the change we want to make. And then also that evaluation and feedback and transparency. Transparency is so important, because while we always want to be successful and do things to our greatest abilities, sometimes things don't go how we planned. Sometimes we make mistakes, and sometimes we have failures, right? So maybe we want to get 40,000 people to take our survey and we end up getting 15,000, right? Personally, I would say 15,000 is still a great number, right? But that wasn't the milestone we wanted, right? And so how do we revisit our process and do better next time? And thinking about how do we do better next time should always be in our head, because we're never going to be perfect. We're human beings. There's no such thing as perfection. And things just aren't always going to go as well as we want. And that's okay, but we need to be transparent about that, and then be collective in our approach of how do we address that? You know, things didn't go as we planned, and what are we going to do about it? How do we do this together? And so that transparency helps to keep folks a little engaged over time. And then other considerations when you're developing your engagement plan is knowing what you can offer. Are you offering expertise and technical assistance and facilitation? Can you offer money? Probably not, but maybe you can, right? Are you offering research expertise, like you know how to analyze data and you can do that? Connection and networking, and do you know lots of different coalitions and partners and organizations in the area, and you could kind of be that matchmaker? Are you offering just kind of general support and guidance? What is it that you're offering? And then also know what you can't offer, because the last thing we want to do is to make promises we can't keep. So if we can't actually pay people for their time, we shouldn't say that we'll do that, right? Or if we say our meetings are going to be 1 hour and our meetings keep going 2 hours, right? We need to be clear and shift our expectations to be transparent that, oh, all right, I thought they would go 1 hour. They're going 2 hours. Are folks okay with that? Or do we need to revisit how often we meet, or revisit the agenda and keep it short and sweet? What do we need to do to make sure we're not doing more than what we said we would do? Also thinking about the timing of your engagement. So is it around holidays or school breaks, or is there something going on in the local community or the global community, like a pandemic, that's going to make engagement a little harder? And to be aware of that, be honest about it and transparent, and flexible with that, right? That flexibility is really important, and that not everyone's going to be on our timeline, but we should be on theirs. I mentioned this before, but I will repeat this over and over again. Have a clear and direct ask. Adult learners, we learn from repetition, so having a clear and direct ask, so important to engagement. Again, it goes back to transparency and communication. These are the expectations of sitting on this coalition. These are your responsibilities. These are my responsibilities. Another key consideration is, how do you demonstrate your appreciation for their time and labor? And I know we can't always pay people for their time and labor, although we should be striving to. Folks who are sitting on our coalitions, we're asking them to engage in our work. How do we compensate them for that time and labor? Can we give them cash? Can we give them a gift card? Oftentimes, I know it's hard, we can't, but we could be pushing our funders to be considering this too. And that's where we can be change agents in this process, holding our funders accountable to demonstrating that recognition of what our partners are doing for us and for them. But sometimes we can't do that, right? So is it offering food in the post-pandemic time, if we're doing that again? Is it verbal appreciation? Other ways that we can show appreciation, maybe we provide childcare if we're doing something in the evenings or on weekends, right? How are we showing folks that we understand they're giving us their time and energy, even though they have other things going on in their lives? And then another consideration is just be willing to hear no. Sometimes it's just not the right time. they're not bought into what you're doing. They don't have the same goals as you. Or they just have so much else on their plate that they really just can't show up in the way that you need in that moment. And that's okay, right? That's where we say, we tried, and maybe we'll revisit in a year, 2 years, 3 years, 2 months, you know, and you can always ask them like, hey, maybe I'll give you a call a year from now. Is that okay? And they could say yes, or they could be like, never contact me again, right? And that's up to them, and then you get to respect that. So those are just some things to consider. And I'm sure you all also have other thoughts and experiences that we can totally discuss and chat about. That is the end of my formal presentation, but I hope we have a nice dialogue with questions and answers. So Carolina, I'll pass it back to you.
Great. So first, CADCA is going to ask Mr. Kattari several questions, and then we're going to turn it over to participants to ask their own questions. So if you have questions that you want to ask, please go ahead and put those in the Q&A box. Just start right now typing those in. I don't think there's anything in there so far, so you have the opportunity to be the first question. And so I'm going to start with some questions from CADCA while you all are putting in any questions you have. So first, this is just something I thought about during your presentation. When you were working on the Healthy Kids survey in Colorado, did you end up talking with or working with any substance misuse prevention coalitions as stakeholders? And what was that experience like?
Yes, absolutely. Some of these substance use and prevention folks were our biggest supporters. We definitely had folks represented on our advisory committee, and they often helped us decide what questions should be on the survey and what shouldn't be. So for example, for the 2017 survey, you know, we get a list of questions from the CDC, especially around substance use, right? And many of the questions were about tobacco smoking, right? And our stakeholders were like, smoking cigarettes isn't really relevant that much for young people. Can we talk about electronic cigarettes, right? And so they helped us figure out what we should be asking, what we shouldn't be asking, what's outdated, how do we update this? And they were also crucial in engaging local communities, right? And so sometimes they acted as the matchmaker between a community leader who can help us get into a school district, and they oftentimes sat in those meetings with us. So they were huge participants in this process of engagement.
All right, so first question here on the slide: increasing survey response rates is always challenging. What is the first step a coalition member, if they're trying to launch their own survey, or a researcher can take when they're trying to increase engagement and participation with a survey?
Yeah, I think that's a really great question. And there's kind of two ways you can approach this. And my initial response is get a feeling for what the landscape already looks like in terms of youth health or any kind of survey topics that you're engaging in. So if it's a youth health survey, you know, what else is happening already across the state, across the nation, in your local community, in the district, and get an idea of what that landscape looks like. And then identify who you need to reach out to eliminate duplication, because survey fatigue is real. I don't know about you, but I've taken tons of surveys about COVID this past year, and I kind of never want to take a survey related to COVID again, right? And so how do we streamline our efforts and not keep reinventing the wheel when there's lots of research and surveys already being conducted? How do we partner with coalition to reduce that burden? And in the case of Healthy Kids Colorado, we really want to reduce that burden on schools. We know their days are jam-packed already. Asking them for a full kind of class period, 40 minutes for a young person to take a survey was taking away from classroom instruction time, right? But having that once every other year was much less of a burden than having multiple surveys that took multiple periods happening multiple times a year or every year, right? And so first, understand your landscape. And then another route, so you have the landscape, it's not happening in your community, you're the first one doing it, you're the only one doing it, is engaging the community directly. And there's lots of great best practices around community engaged research, which follows a similar guide as kind of, you want to build trust and relationships, you want to focus on local expertise or the community's expertise, and then you want to show up and be there for them and engage them in that research process from the conception of the idea, right? Have them be part of that process from the very beginning all the way to results dissemination, right? And folks should be part of that process and doing it intentionally and authentically, and in a way that builds leaders within those communities to do research of their own. So you're kind of passing the baton to that local expertise.
Okay, we have a question in the chat box, and it seems like you kind of covered it, but maybe if you want to, if there's anything else you want to say about this, Karen posted that we continue to encounter pushback from our school system regarding time. They don't want to use instructional time for surveys. This time isn't, or that time isn't the right time to administer surveys. And like, how can we address that and move forward and get answers and data about substance misuse in our communities?
Absolutely. Karen, this happens everywhere. It is so common. And it's really finding your allies within a school system to help get you in and start having those conversations. And so there was one district in Colorado, and I'm not going to name names, but we historically never had luck getting them to participate in our survey. And so what we ended up doing was, we're like, okay, the goal now isn't even getting the school district to participate in the survey. The goal right now is to build the relationship with this district and find who understands data, what are they already collecting? Because that was one of the things, they're like, we already collect all this data, right? And so how do we understand what's happening in the district and build those relationships and build that trust? And we would have meetings with them quite often, and every meeting there'd be like a higher level decision maker that would join us at some point. And it took years and years and years. And then in 2017, they finally participated. They were an opt-out, so they didn't even require parental consent to opt in, and they had like almost 100% participation, right? But it took us years to get there with them, and it was consistent, persistent communication with them and lots of dialogues, and finding the right teachers and staff members to open the door. Parents are also key. So engaging parents and other community leaders who have maybe other relationships with school administrators, because again, you're the outsider typically. And so how do you get folks who are already trusted and in relationships with those decision makers to advocate on behalf of this, and emphasizing the mutual benefit that, look, the survey itself, yes, it's great for Colorado to have, or it's great for my organization to have, but you benefit from this too. And with that, I'm going to actually answer a question from Vicky about what kind of outcome reports data was created from the survey results and how was it fed back to schools and communities in digestible bites. And that's such a great question. And that goes back to like, how can it be mutually beneficial? And so what Colorado did is we had because it's a governmental agency, all the statewide and regional data was available to the public. And we had lots of undigestible, very hard to read tables, but people could sort through it if they wanted to have access to it, that had every question and all the responses based on demographics and regions. But we also created infographics, and we would ask the local communities and our advisory board members, like, okay, what are the topics we should be highlighting? And each survey administration, with the results, we would create 20-ish infographics to make the data more digestible, right? So Colorado, one of the first states to pass recreational marijuana laws. We knew that was going to be a hot button topic for the 2015 survey results, right? And so we made sure we had an infographic that addressed that in particular. The shift from e-cigarettes and vaping from cigarettes, we knew that was going to be a big one. So we made sure we had an infographic on that. And so that was more of like the broad statewide audience. Other ways that we did this was schools would get their own reports of the data, and that's not shared publicly. That was just for the school to have. The health department actually didn't have any interaction with that data at all, so that it would never be public access. And so the university, based on their institutional review board and protections, would communicate directly with the school district with that data. And so then they would get school level reports or district level reports. They would get both. We would also go in and do presentations if they wanted to do like a PTA meeting and have us come in, or if like the wellness team wanted a presentation, we would do that. We would also do work with a couple of teachers wanted to involve their students with the analysis and understanding and disseminating the results. And so we would do some cool workshops with young people for understanding data. And then they would create their own kind of presentation they would do for the school board or for their parents around what the data said around whatever topic. So mental health is usually the common topic, where the young people would come up with some way to present the data to their local community, to their peers, et cetera. And that was probably one of the most fun ways to disseminate the data, was actually involving young people, because they were always surprised to be like, oh, this is what's happening in our district or in our school. That's good to know. But I think that translation is super important, and making it digestible is really important. Sorry, Carolina.
Yeah, so I'm going to ask another question from the chat. This is referring to an example in a Colorado district that you were talking about, where they just did not want to participate at the school board level. Myra asks, would you ever consider opening the survey for students to opt in themselves and select that they're in a district that's not participating in the survey? And would there be any concerns with this approach?
Yeah, so that's a really great question. And your kind of methods will inform how you approach this. And so from the Healthy Kids Colorado perspective, our sampling approach was very much, we wanted to do it in a way that it would be representative data. And so if we couldn't get a district or a school on board, we would miss all those students because we were sampling specific by school. And so having just an individual from a school that wasn't participating would kind of make the results less representative because it wouldn't be based on our sampling frame. But that's based on how the CDC does YRBS and how we were doing Healthy Kids Colorado survey. If there's other, if you're not going directly through a school and your sampling frame isn't school-based, then I think you could go directly to young people. But if you're doing any kind of research with young people, I would highly recommend partnering with the university if you're not already doing so, and making sure you get some kind of institutional review board permission, so that you're doing it in the least harmful way possible for young people, and then there's some kind of accountability. And you definitely, for anyone who's under the age of 18, you need to get parental consent. That's just something to consider. But the sampling frame for Healthy Kids and for the YRBS, it's based on student population data based on district and school level. And so that's how we were able to know how many students lived in this district, how many live in this district. It's based on that school enrollment data. And so that's why our sample was based at that level rather than at that individual level.
Yeah, I was going to mention parental consent for sure. That's something from a CADCA perspective, I would always want to highlight when you're doing a youth survey to make sure you do have that parental consent. So I'm glad you brought that up, because it's very important, and it kind of leads into this next question from Melissa. Have you had to address parents or community members' concerns about sensitive questions on substance use, ACEs, sexual activity, orientation, and gender identity, these kinds of things? And then what strategies do you use to, if there were parents and community members that are resistant to these kinds of questions being asked?
Yeah, definitely there was often concerns around sensitivity of different topic areas for young people. And one of the questions that we often got or concerns was like, if you ask about substance use, young people are going to engage in that behavior, and I would point to the research. I'd be like, actually, that's disproven. And since we started asking, since the YRBS started in the early 90s, all these behaviors have actually gone down. But that doesn't help alleviate those concerns, right? This is your child, you're concerned, you don't want to harm them in any way. And so sometimes what we would do is we would talk through the concerns and have a dialogue, open a meeting, either if it was a superintendent or principal that was concerned, we would sit down with them. If it was parents, we would have like a parent forum, town hall style, and we would just, we would present on what the survey was, what we plan on doing, what some of the questions were. The survey instrument itself was always posted on our website, so parents could look and have, so we were trying to be as transparent as possible about what we were asking. So we were trying to like address any concerns about questions, and sometimes that wasn't enough. And they're like, nope, we're still very uncomfortable with asking our kids about suicidality, right? And so the other strategy we use is that some schools or districts would block out specific questions. And so maybe they removed all the questions that asked about suicide. And that's not ideal, right? Because then you're losing that data for that area. But then you still have that other data around other health outcomes, right? And so it's kind of like this harm reduction approach of like, all right, we don't have everything, we want everything, but we're getting something from it. So that was another strategy. But again, a lot of communication, and some schools that used to block out questions, after we sat down with them years and years down the line, we're like, oh, they're actually not harmful, and we want to ask these questions. We think it's important to know about the sexual health of our young people. Our pregnancy rates are up, or we notice STI rates are going up for our 13 to 17-year-olds. We need to start asking about these questions, right? So it's that consistency too, and sitting down and having conversations. And again, it doesn't usually, the first conversation is not going to change it, but after a year down the line, you'll likely eventually get there.
And so we have another question in the Q&A box that's more so about community engagement, and it's from Laura. She says, what level of staffing does it take for this type of community engagement? And I think that is an interesting question for coalitions that are short on resources. So we'd like to hear your thoughts about that.
Yeah, I mean, I did a lot of I kind of had like the Leo roadshow where I would travel by myself to do it. And again, travel does cost money, and I acknowledge that that could be a big barrier. But you really, depending on how big the survey is, or how big the effort is, will determine what staffing needs to look like. You could have, I would say you need one position dedicated to it, 140 hours a week, which is always more like 50 or 60 hours a week, right? Right, so you do want to dedicate staff time to it. And again, that's where we can hold our funders accountable to say, we're a coalition, we're doing this work, we need someone who can do this and do it well, because we don't really want to just, lack of a better term, half-ass this.
All right, I'm going to jump to the second question on this slide, actually. So the strategies for community engagement described in this paper were directed at mostly the rural communities in Colorado. But do you think that these strategies would also be effective in urban or suburban settings, and then also in other states across the country?
Yeah, I mean, I think they're adaptable across the board to any kind of community in any setting. I think there's a little more intentionality and thought for rural communities, especially the health department was located in Denver. So a lot of the metro area schools and organizations already had pre-existing relationships and partners with the health department, whereas the more rural communities less so. And so we knew we really needed to invest in building that up in ways that were less natural than the ones that were organically near us. But I think this works in suburban areas, as well as urban and across the board in different types of communities and populations.
Okay, we're just past 3 p.m. So let's talk quickly about this last question on the slide and then wrap up the webinar. So where can interested coalition members find more information about your work? And then what other resources can you recommend for coalitions that are interested in youth health survey administration or interested in more information about effective community engagement?
Absolutely. So more resources about my work, you can find kind of my profile on the MSU website, which I didn't pull up in advance. Google Leo Kattari, it'll come up. You can also, Health Promotion Practice, the journal, has a section called Practice Notes that's trying to bridge the gap between kind of academic journal articles and actual like practice implementation strategies. And so I highly recommend reaching out, Googling or looking at Health Promotion Practice Notes. And there's so many resources for folks in the community around if it's survey engagement or interventions and best practices for generally community engagement. It's so great. And also, if you have a best practice or you adapted a program or you're doing something that you really think other folks should know about, you should consider submitting an article to Practice Notes. They're not intensive by any means. They're 3 to 4 pages. And it's really just your opportunity to share your own experience and expertise with the nation, the global community. So I highly recommend you do that because I know there's lots of you in the room or in the Zoom room who do incredible work. So sharing that would be wonderful. And then I would say for youth health surveys, a great place to start is with your state health department or state Department of Education and see what they're doing already, if anything at all. And then from there, I think with the Healthy Kids Colorado survey, we had lots of different types of coalitions, right? We had our substance use coalitions, our sexual health coalitions, our nutrition coalitions, right? And so who else is doing similar work that might have similar goals to you that you can reach out to? But I think starting with kind of your state governmental agencies is a good way to start. Or reaching out directly to your school district or schools and seeing what they're up to, who their partners are, might be helpful as well. And also your local universities, because there's usually folks doing community-based research at the universities, and so they could be a good resource as well. And they could have funding that they can offer up to you as well. So don't hesitate to ever ask your university partners for money.
Great. So let's go to the next slide quickly. You'll notice at the bottom, it says read an electronic copy of the article mentioned in this presentation, and there's a link there. So when I distribute the slides, you'll be able to click that link. And it is a read-only electronic copy of the article, so you won't be able to download it, but you will be able to read it for free. So I hope that is helpful to everyone.
Yes, the link for, it'll be like 80 days, so 90 days, but I pulled it a little over a week ago. But if the link no longer works and you want a copy of it, you can shoot me an email and I can send you a copy. Authors can always distribute their work that way and not impede on copyright. And if you have any other questions or thoughts that didn't get answered, please feel free to shoot me an email. I put my email address in the chat box.
All right, and let's go to the final slide. So before we finish, I will distribute a copy of these slides and also the link that I just mentioned to the article. And that email will contain also a short evaluation. It's very short. I know about the survey fatigue, we talked about it, but truly it's short for this webinar, so please fill it out. And if you'd like a letter of participation for this webinar, when you fill out the evaluation on the thank you page, you can click continue and that'll direct you right to a letter of participation that you can download. So you do need to fill out the evaluation to get the letter of participation. And then you'll want to download it right away because it'll be hard to get back to that page if you X out. And I'm also going to post the recording of this webinar on the CADCA website and try to collect some of these resources that were mentioned as well to send to you. So thank you to Leo Kattari for the wonderful and comprehensive presentation on your work and for your commitment to providing relevant and current material. And thank you to webinar participants for your comments and your questions and your insights in the chat. And I'll see you all for the next webinar.
Thanks, everyone. Take care.